Hello, I'm Emma Hammett from First Aid for Life and onlinefirstaid.com. Today I'm going to talk to you about strokes, about what causes them, how to spot them and what to do. So a stroke, sometimes known as a cerebrovascular accident or CVA, is a disturbance to the blood flow in the brain caused by a blockage or a bleed in one of the blood vessels supplying the brain. And blockages in the brain are a lot more common than bleeds, although both have the same symptoms. And the majority of the time, the blockage is a clot. So a blood clot that has occurred somewhere in the body, maybe as a deep vein thrombosis, and it has ended up blocking one of the major arteries to the brain. A stroke can happen to anybody of any age, although they're more common in older people. When I was nursing, I was volunteering in a teenage stroke unit, and obviously it's more unusual for teenagers to experience strokes, but it's really important that they can rehabilitate and recover together in a group of similar aged people, because a stroke is a very frightening thing to happen. Now, a lot of people experience life-changing damage as a result of a stroke, and for some people, a stroke is fatal. However, for others, they're able to make a full recovery. And the key is to identify that somebody is having a stroke as quickly as possible. And if you can get them to a hospital, and if they're having a stroke caused by a clot, and they can use a clot busting treatment within 3 hours of the person experiencing the stroke, then the chances of making a full recovery are considerably higher. So the key thing is to identify and spot early signs that somebody might be having a stroke and get emergency help fast. So the acronym for spotting the signs of a stroke is FAST. So you want to look at their face. Can they smile and show their teeth? And is it an equal smile? If they raise their arms and hold them, does one of the arms fall? So you're looking for them to hold their arms out in front. If you ask them to repeat a phrase that you give them, is their speech slurred, and do they have any difficulty remembering the words? And tongue. If they stick their tongue out, is it crooked to one side or the other? So the FAST test is a really good, quick way of getting somebody to identify that they may be having a stroke and to act fast. They may also have unequal pupils. They may lose consciousness. They may have a marked weakness down one side. They may have an absolutely vicious headache that's unlike anything they've had before, sudden blurring or loss of vision, dizziness, confusion, difficulty understanding what somebody is saying, problems with balance or coordination and difficulty swallowing. Any of those can be a sign, but the FAST test is a really good, clear one to identify quickly that there is a problem. So your strokes, you can have ischemic strokes and hemorrhagic strokes. An ischemic stroke is a stroke caused by a blockage, and it could be caused by a plaque or something coming off the inside of the blood vessel, like your atherosclerosis, your fatty deposits inside the vessel, or more commonly, it's caused by a clot. A hemorrhagic stroke is caused by a bleed. My father died from an aneurysm on the brain that ruptured, and that's what killed him. So a hemorrhagic stroke, they are less common. It's also less that the hospital can do to help. Although saying that, if they catch it in time, there is still surgery that they can do. It depends on the size of the blood vessel that has ruptured and how quickly it's caught and how much of the brain is affected. So rapid response is absolutely vital. That 3-hour window allows them to use Alteplase, which is the clot busting treatment, if it is caused by a clot, and they will test first to see if that's the situation. And not everyone is suitable for altarplays. But if you are suitable and you're at a stroke unit, then it's a really helpful thing, and it can reverse a lot of the damage that has been done. The key to prevent a stroke is to keep your blood pressure down, cut down on the stress, all those lifestyle factors and things that put your blood pressure up obviously make it more likely that you might experience a stroke. But there's also genetic factors and things going on there as well. In terms of recovering from a stroke, physiotherapy is usually vital. And the other thing to say about strokes is that you can have things called TIAs, trans ischemic attacks. And these are like angina in the brain, if you like. So your stroke is like your heart attack, and a TIA is like angina for the brain. So it's a warning sign. It's like a little mini stroke, and they can have all the symptoms of a stroke, and it can last just a few minutes or up to a good few hours, but it resolves completely. And that is a sign that you have some damage to the insides of your blood vessels. Maybe there's little clots coming off, and you need to get investigated. If you're investigated for a TIA and they can find the cause for them, then they can prevent you having a stroke. Sadly, if you're having TIAs, it is warning signs and you are at a higher risk of experiencing a stroke as a result. So make sure you get them investigated. Never ignore any of these sorts of symptoms. Get checked out fast and get checked out in a stroke unit. So your main risk factors for a stroke are your age. They're more common as you get older. Underlying medical conditions such as diabetes, atrial fibrillation when your heart's got a flutter, and raised cholesterol and raised blood pressure, and the stress lifestyle. There's also quite a known link with the contraceptive pill. So if you're on the combined contraceptive pill, it's really important that you get your blood pressure checked regularly, and they will monitor that in order to keep your blood pressure down. And there also may be a contraindication to you being on the pill in the first place. Pregnant women are at greater risk of raised blood pressure too. And there is also an increased risk with Afro-Caribbean population and with the South Asian population. And part of that is also due to the fact that people of Afro-Caribbean and South Asian origins tend to have a higher risk of diabetes, of raised cholesterol, and consequently of heart disease and stroke as well. So lifestyle factors are even more important if you're from that ethnic group. So I hope that has been helpful. That's Emma Hammett from First Aid for Life and onlinefirstaid.com.